Something that I thought was really cool about the application process to Tulane Medicine was the vast majority and opportunity for dual degree programs at Tulane. Something like 20 to 30% of MD students also do a dual degree, and so when I saw that that was kind of the norm, I wanted to be a part of it. Even more detailed when I got into the medical school, they sent kind of a list of all the different dual degree programs, and I saw this one and kind of knew it was for me. My history through the pre-med course in college, I had always linked in some sort of humanities. For me, that was writing and writing poetry, and so I had done a lot of studying and kind of work in the humanities, and I knew that I wanted to keep that part coming with me through medicine. So it kind of just fit perfectly, and it was a good opportunity for me to learn some of the soft skills of medicine, but also kind of itch that scratch for the humanities that I've always had. It was really incredible. We got to start the summer before medical school courses started, so I got to meet a couple of friends before getting into the real hard medical content. Further than that, talking to peers, I always told them that the conversations we were having in our master's program, the Master's of Bioethics and Medical Humanities, was the conversations that I feel like our generation of physicians is really craving. So we were having the important conversations, not just about what we're learning in terms of our physiology, but what does that mean for patients? How do we decide what illness is? How do we treat people differently, and how do people kind of occupy illness in a different way? So I felt like it was having all of the important conversations about medicine on a day-to-day basis, 3 to 4 hour long conversations with some other really intelligent people. And so nothing was too bleak or too scary or too offensive, and we can kind of put it all out on the table and really get to understand why we do things the way that we do in our profession. So I was pretty undecided coming into the fourth year of medical school about what field I wanted to go into. So the third year was really just me testing out everything. I ended up really loving OBGYN, and that's the field that I'll be pursuing. And knowing just what I know now about going into the field, obviously there's, for good or bad, there's a lot of life and death. There's conversations about fetal and maternal mortality, which I feel really trained and ready to have. There's intimate conversations with patients about decision-making and reproductive justice that I feel like I'm also really well trained to address. Further than that, just your everyday conversations with patients. I've asked medical students if they've encountered an ethical dilemma in their medical training, and it's kind of interesting the degree of people that will say yes versus no. And I think for me, I really just recognize that any conversation with a patient is an ethical interaction, whether that's if they can access their medications or the time that they took off of work to come in to see you. So I think for me, it's just kind of seeing the ethics in everyday stuff in medicine, but more so just kind of the things that I'll be able to take care of specifically in OBGYN. We started the summer before medical school started, and some of the courses that we took were the philosophy of medicine, which was an incredible kind of jump start to what we were about to do for 4 years. And like I said, it was how do we define illness, and what is ill? What is ill versus disease? What is good versus bad? Further than that, we took the MD as author, which was an opportunity for us to read books written by other MDs. And so not every physician is an author, but it kind of set us up for the types of physicians that I believe me and my cohort will be. A more humanistic, touched in the importance of narrative medicine and patient stories. And then through the curriculum, we got to decide whether, what of two tracks we were more interested in, one being bioethics and the other being clinical ethics. And I chose clinical ethics just for the opportunity to really be able to engage with patient scenarios on a day-to-day basis in the clinic, in the hospital. And some of those courses included research ethics. So actually, how do the ethics behind your research project go? It included death and dying. So we read multiple books and watched movies about the death and dying process, and how family members in different cultures react to that, and how to talk to patients, and how some patients' preferences will be different around that dying process. We finished the course off with kind of externship in whatever field we're going into, so I got to follow some clinical ethicists and see some ethics discussions around patient scenarios in the hospital. And so I feel like it's really just given me a really well-rounded education through all of the different ways that ethics populates clinical health and medicine in general. So I'm really thankful for the courses that I've gotten to take and the professors that I've met. And even more so than that, I know that the people that I've met here in this ethics department will help me find other people in ethics when I move to Seattle and even further than that. So I'm just really excited to be part of the ethics and bioethics community.